Patients are very grateful. I think you're starting to see the attitude change here locally. When I got here, it seemed like everybody wanted to go out of town to do all their medical needs, and then COVID hit and it made it, I think it put up a lot more barriers, but then more docs started coming here.
Yes.
We started getting more and more docs and subspecialists, and hopefully that mentality is changing where I don't have to go out of town to do all my treatments.
That's exactly right.
That was the biggest hurdle day one. I was just so frustrated that every time I'd see a new cancer patient, like, oh, I'm going to MD Anderson, or I'm going to Mayo, or I'm going wherever, and I was like, you understand, we train at these programs. We didn't train in Panama City. You know, we bring that expertise with us. That's we live here because we want to live here.
That's right. And you are perfectly comfortable with saying, whoa, this is a very rare cancer. You would be served best by going to MD Anderson or Mayo or something along those lines. Or this is wheelhouse, and we can take care of this with you being at your home, which is much more favorable than going to get hotels and other things and the travel of all that stuff. I mean, certainly, you know, the physicians that I found that are most confident in themselves would say, get a second, third, fifth opinion. I'm totally fine by that. But I will be honest with you about the things that I'm comfortable with, and I'm pretty comfortable with this, and we can take care of this here and at your own comfort.
Yeah, you hit the nail on the head. If you run into a doc that says don't get a second opinion, you need to run.
Run, yeah. Run, don't walk, yeah.
Yeah, because you're right. We're all comfortable with that because we're comfortable in our decisions. Somebody overlooks our shoulder at an academic center and says, yeah, I agree with exactly what you're doing at home. Stay at home.